Hello, I'm Art Franklin. We're seeing surges in coronavirus cases. The death rate is rising. Hotspots are shifting. The threat is just undeniable. We're also hearing about hope when it comes to finding a vaccine. Well, joining me in studio is UAB's infectious disease expert, Dr. Michael Sag. Dr. Sag, it's really good to see you.
Thanks, Art. It's really good to be back, and there's so much to talk about.
Absolutely. We've got a lot to talk about just a short period of time. And joining the House Calls team for a follow-up appointment is Dr. Anthony Fauci. We're going to get right to our coronavirus checkup with the nation's top authority on COVID-19. So, Dr. Sag, why don't you get us started with your friend Tony Fauci?
Yeah, Tony, it's great to have you back with us again. This week, we hit another record in new coronavirus cases in the United States. As you know, the University of Washington has projected that the U.S. death toll could be more than 200,000 by the 1st of October. But we could drop that number by 40,000 if 95% of us would wear a mask. And you and I, along with most of the health experts, have been saying to the public, wear a mask, keep social distance, yet there are many who don't. Why is it that you think we're having such trouble, and what can we do about it?
Well, Mike, as you know, we share the feeling. It's very disturbing, and it really is somewhat puzzling. I think what we're seeing is an unfortunate pushing back on what people interpret as an overreach on the part of authority to telling people what to do. They seem to be forgetting that this is about public health. This isn't about authority. This isn't about individuals trying to tell you what to do with your life. We are all in this together, and if a certain segment of our population does not adhere to these kinds of public health recommendations, then the system is not going to be as optimal as it could be, and perhaps could even fail. There are certain fundamentals that we know work. We know that they do. We've seen it not only in our own country, but we've seen it in other countries. Physical distance, avoiding crowds, but certainly wearing a mask is one of them. We just need to try to keep getting that message across that we all want to pull together and be part of the solution and not part of the problem. But it's very disconcerting that we're seeing so many people pushing back on this.
And Dr. Fauci, the CDC provided guidelines for safely reopening schools, but the president disagreed on Twitter, calling the guidelines tough and expensive. So the CDC said it will issue new guidelines. What's your take on the CDC guidelines for reopening schools? And is there any communication between the CDC and the White House task force on the delay?
You know, obviously the CDC presented the guidelines and discussed them. You know, right now, I think what we need to do is to get beyond the debates and realize that we all want to open the schools. That should be something that is a high priority, for the simple reason that if you take a default position, we know from the downstream unintended ripple effects of not having children in school that we can have deleterious effects on the parents, on the child's psychological status, et cetera. Having said that we will try as best as we can to keep the schools open, we've got to remember that paramount to all of this is the safety and the health of the children and of the teachers. And so we need to remember, and I think this is something that where there's confusion, Art, is that we live, as we know, in a big country that's very heterogeneous geographically and demographically, and importantly, with regard to the level of viral activity in different states, cities, counties, regions. So there will be places where opening up schools and getting the kids back will be not a problem at all because of the level of infection. But when you have situations where you're in locations where there is a degree of viral activity, then you've got to take a look at what you can do to mitigate any possibility of compromising the safety of the children and of the teachers. And that could be various creative ways to get the schools open where you lessen the risk. And I've heard from principals and superintendents of different ways, hybrid solutions, part in school, part online, alternating days, morning, afternoon, outdoor as much as possible. Sometimes you just have to push back and not open the school. That's a possibility that things would be so difficult that the parents and the teachers might not want to even come back. So there's going to be such a wide range of circumstances that I think you need to take it on a case-by-case basis.
Tony, let's talk science for a second. There's been some promising results so far with the vaccines undergoing human trials, and most notably, very recently, the AstraZeneca and Oxford University vaccine. But from your perspective, what are the differences we're seeing in terms of immune response between these different vaccine modalities from Moderna to AstraZeneca?
You know, plus or minus, Mike, they're about in the same ballpark. I don't want to be singling out any and critiquing it, but if you look along the lines of those who have now finished phase 1 and even phase 2 and have data on safety and a degree of immunogenicity, if you look upon, I'm impressed in a positive way with the fact that even though there are different platforms that are being used, that the induction of neutralizing antibodies at doses that seem to be acceptable and levels of neutralizing antibodies that are really rather robust is encouraging. Obviously, we need to do more studies with more people, but I'm actually heartened by what I'm seeing, that more than one candidate appears to be inducing the kinds of responses that favorably might produce a degree of optimism about whether or not they're going to be able to block infection.
Yeah, and that is great news in the middle of a lot of more sobering news, such as 49 hospitals in Florida have no more ICU beds. Some hospital in Texas, Arizona, California experiencing the same problem. Doctors and nurses are exhausted. What are your thoughts about policy in terms of what governors might be able to do in terms of, we don't want to do it, but returning to shelter in place? How are they going to make those decisions, in your opinion?
Mike, that's a great question. And I think if you look at what the root cause of why we're seeing this resurgence is, they just don't happen spontaneously unless the response to them or the attempt to open up had something that you need to reconsider. So if you look at the states that are involved, and I certainly am not going to single out any individual state, that's not helpful. But if you look at a number of states as a group, some of them, when you look at the guidelines of opening America again, where you have the checkpoints, you have the situation where you start off and you talk about a gateway, and then you go to phase 1 or phase 2 or phase 3, that some states, in their effort to try and get back to normal quickly, have skipped over one or more of those checkpoints. That is inviting difficulty. In other situations, the states did it quite right, but the people in the state took an all or none attitude. And instead of doing the step-by-step care, you see pictures, films, clips of people congregating at bars with no masks, in crowded places, not doing the physical separation. That is a recipe for getting into trouble. So right now, what we need to do is call a timeout. I don't think, Mike, we need to all go back to lockdown. I think that would be very discouraging to a lot of people and could even be counterproductive. But we need to pause in the opening and maybe even take a step or a step and a half backward and say, okay, we still want to reopen. We want that as an important goal, but let's do it in a prudent way, concentrating on some fundamentals. You know, you could call them staples or fundamentals of what you need to do. And that is universal wearing of masks, avoiding crowds, physical distancing, close the bars. That's the big offenders. And personal hygiene, things like washing your hand. As simple as these things sound, I'm confident if we do that and we do it consistently over a period of a couple of weeks, not only will we get back to the control in those states that have gotten temporarily out of control, but we also will prevent other states from getting into the same difficulty that some of the southern states where there was resurgence got into. So it's something we can do, Mike. I believe we can do it.
That's good to hear from you on that, Dr. Fauci. You've also been the subject of some sharp criticism by the president and some members of his administration, some of them even taking jabs at the accuracy of your work. Most recently, the president called you, and I quote, a bit of an alarmist. But your entire career is based on your credibility. This type of criticism has to have some type of impact on you personally. What's your reaction to those comments?
Well, Art, it's unfortunate, as I've said, that kind of noise just gets in the way of the common job that we have and the common goal that we want to reach. It's just unfortunate that some people have made those kinds of remarks that are really not founded in any reality at all if you dig deep into it. So I wish that we just put that aside and concentrate on what the problem is here. The problem is the virus, and just put aside all that nonsense.
As you put that aside, certainly you've put aside even considering resigning from the task force, right?
Oh, definitely. I'm not even thinking about that.
Very good, very good. Dr. Fauci, can we expect to see you at today's coronavirus task force briefing? From what we understand, the president is expected to make an appearance there.
Art, to be honest with you, I don't know. I have not heard anything definitive about that. So I just don't know whether I'll be there or not.
So, Tony, we acknowledge that these are hard times. What, besides throwing out the first pitch in the Nationals game on Thursday, what gives you hope?
Well, I'm a little bit anxious about throwing out that pitch. Mike, I was a baseball player as a youngster, but I haven't picked up a baseball in such a long time. But putting that aside, I just think we need to just concentrate. All of these other things are kind of peripheral. We just need to concentrate on the very important goal we have. And I hope, and I believe cautious optimism that we will put together as a nation to get through this. This is going to end, but it's going to be up to us. It's not going to end spontaneously. We've got to do the things that are necessary to put a stop to this.
Any time frame, Dr. Fauci, do you think that we have for this virus ending, this pandemic?
Well, it's dangerous, Art, to make those kind of predictions because you never know when you're just going to be dead wrong. But I think we have to go step by step. The first step is to get all of this viral activity down to baseline. If you look at the graphs that reflect some of the European countries and even the European Union as a whole, they went way up, peaked, and came down essentially to a very low baseline, measured in tens or hundreds of cases per day, not thousands and tens of thousands of cases a day. So the thing I'd like to see right off the bat is to get us back down to a real baseline. Because remember, we went up, came down, and then we plateaued at around 20,000 cases per day for weeks and weeks in a row until most recently, as we all know, very disturbingly, we've gone up to 30, 40, 50, 60, and even 70,000 new cases on a day. We've got to get that baseline down so that when we try to, again, open America again throughout the country, when we get individual cases, we'll be able to get our arms around them and handle them very quickly without worrying about a massive amount of community spread that's going on.
Well, Dr. Fauci, with the precious few minutes we have left with you, we'd like to get your quick thoughts on a few things. And we've all seen the video from around the country of those crowded places like pool parties. You talked about the bars. What do you think about when you see those images?
Well, what I think is that I don't think that and most of them are young people, that the youth of our country are really reckless or stupid. They're not. I don't think they fully realize, and this is the misinterpretation, that they know statistically that if they get infected, the likelihood of their having a serious problem is much less than the general population. That's true. But one thing is that they could be wrong because even young people can get seriously infected. Serious consequences of disease. But the one thing that I think isn't fully realized, that even if they get infected and they're completely without symptoms, which could happen to a certain proportion, that doesn't mean that they're not contributing to the pandemic. Of course they are, because they're propagating it and allowing it to continue. Even though innocently and inadvertently, they may be passing the infection on to someone else, who then inadvertently passes it on to something else. And then finally you get someone who's going to get a very serious consequence of infection. Someone's father or mother who has chemotherapy for cancer, a young child with an immunodeficiency, then you start getting to serious disease and death. I don't think that the young people that you see at the bar having fun, having a drink, crowded together, I don't think they're thinking about that. So I would hope that by our continuing to bring it up, we let them know that they are really being part of the propagation of the outbreak and part of the problem, as opposed to just living in a vacuum, not worrying about the fact that they unlikely will get a serious consequence.
So some politicians are fighting back and don't want to follow the science of the virus. Some quick thoughts on how we can get everybody in line and work together with one common message?
You know, Mike, I think we just need to come at it in a non-accusatory, non-pejorative way and try to appeal to the better side of people to realize that we're not trying to be authoritative, we're not trying to be dictatorial, we're just trying to give them the pure scientific and public health facts. And as you said in the beginning, we know that if people do things like universally wear masks, avoid crowds, keep distance, do those kinds of things, that we will turn this around. We've got to get people to appreciate that. As much of an effort as it is, we've got to keep plugging at it.
That's good advice. And Dr. Fauci, finally, I've seen some pictures of you playing basketball. You talked about the fact that you did play baseball. So how would you assess your fastball?
My fastball is such that if anybody is even a moderate hitter, they'd probably blast it out of the park.
I'm sure you're going to do pretty well when you throw out that first pitch, though, right?
Yeah, I hope so.
All right. Well, Dr. Fauci, we want to thank you so much for joining us and for the work that you're doing to keep America informed.
Tony, we really appreciate you being with us. And for all of us, thank you for what you're doing. You're making a huge difference for all of us. And to all of you out there, thank you for watching. I'm Dr. Michael Sag.
And I'm Art Franklin. For all of us, be safe and have a great day.